Alrighty, Chapter 11, Scene Size Up. This is going to start our patient assessment section of the book. Um, Patient assessment is a very, very valuable skill, one needed for all levels of healthcare, but especially in EMS. And it all starts with the scene size up. We will be talking about the scene size up. Okay, scene size up. Um, you have to remember that scene size up starts way before you even get on the scene, right? It starts from dispatch. You're gonna get information from your dispatcher that you're gonna start doing your scene size up, start thinking ahead. Is this gonna be is this gonna be a mechanism of injury? Is it gonna be a trauma? Is this gonna be a medical call? Is there possible hazards? Maybe we've been to this place before and we know there's possible hazards, and on and on and on. So it starts with the scene size up, the elements. One of the big things we're checking for scene safety, right? If the scene is not safe, we as EMS is not going to enter it. You're going to hear that all the time, your entire career. Scene safety, scene safety. We'll be taking standard precautions, but at bare minimum, putting on gloves. We're going to be noting the mechanism of injury or the nature of illness. We'll determine how many patients we have, and we'll be deciding if we're going to need extra resources or additional help. The only predictable thing about emergency is that they are very often unpredictable and can pose some dangers. As you're nearing a collision, like a car wreck, you're looking and listening for other EMS units approaching. You don't want to get in a wreck yourself. You're looking for signs of power outage, like a pole being broken, wires on the ground. We're going to be observing the traffic flow, and we're going to look for smoke in the direction of the collision scene. This is as we're approaching, or when you're near the scene. When you're within sight of the scene, excuse me, you're going to look for clues indicating hazardous materials, like fumes of gas or liquid flowing. We're going to look for victims on or near the road. We're going to be looking for smoke that maybe we didn't see from a distance. And we're going to be looking for those broken power poles and down wires. Be alert of people walking alongside the road towards the collision. These could be bystanders, people wanting help. Could be your patients. Okay? And you're going to watch for signals of the police officers and other emergency personnel. They'll tell you where they want you. As you reach the scene, you're going to follow instruction of the person in charge, which is your scene commander. And in most instances, it's the fire chief or the highest ranking fire official is usually your incident commander. We're going to put on the appropriate PPE, including could be head protection, bunker coat, and a reflective vest. At the bare minimum, on a car wreck, you're going to have your 5-point breakaway reflective vest. We're going to kind of take a small sniffer odors that indicate hazardous release. We're going to establish a danger zone around the wreckage of every vehicle collision, right? So we're going to establish this danger zone. Specific guidelines for these zones. When there are no apparent hazards, 50 feet all around this is going to be your danger zone. When we see fuel spilled, we're going to back that up to 100 feet in all directions. And from the fuel, 100 feet from the leaking fuel. So if the fuel leaked out and it's 10 feet away from the car, we're going to establish a danger zone 110 feet away from the car. When a vehicle is on fire, it's going to be at least 100 feet in all directions. When wires are down, like highline wires, we're going to go one full span of wires from the pole to which broken wires are attached. So we're going to go to the next pole that's still standing. We're going to go one full pole away from that. So we're to ensure we're not going to get any ground arcing or get electrocuted through the ground. When we have some sort of hazardous material, we're going to check the ERG or the Emergency Response Guidebook, and it'll give you specific danger zones or how far apart or far away you should be for each specific hazardous material. Crime scene and active violences. We're going to evaluate for threats, right? Like fighting. We see people fighting. That's a threat of violence, or they're arguing, screaming at each other, loud voices. We see weapons, or they're in use, like guns or knives, ball bats. Just about anything can be a weapon, actually. Signs of alcohol or other drug use could be a threat of violence. Unusual silence, right? When we're on a scene of a call, and we're on the scene at the call, we should hear noises. So unusually silent is a big key that something's wrong. And knowing that there's been prior violence at this facility or house or residence is a big key that you want to keep a high index of suspicion. We're going to talk about standard precautions, or BSI, and PPE. Remember, these are interchangeable. BSI is body substance isolation, which would be your gloves, your mask, all this other stuff. Now, personal protective equipment can be a little more because it can be like bunker gear, helmets, stuff like that. Nature of the call. We're going to find out what the nature of the call is during the scene size up. This is why we were called, right? Is this a mechanism injury, a trauma, or nature of illness, a medical call? So why were we called? So we need to figure out which it is. Is it a mechanism of injury? And if it is, what is that mechanism? And if it's a nature of illness, what the nature is, why we're there. Mechanism of injury. The definition of forces that may cause injury. That's what the definition is. And if you understand these forces, you may be able to predict injury patterns. We may not be able to see an external injury, but by the mechanism, we can be like, ooh, he may have some internal injuries. And can be very useful in predicting injuries associated with certain types of motor vehicle crashes. Now, here's a nice picture of a crash. You see the windshield all scattered. This looks like a rollover, right? Because the hood's all smashed in. This is probably a pretty good wreck. Okay, with motor vehicle collisions, a head-on collision, that's when the cars hit the front, right? We see two types of injury patterns. We got the up and over or the down and under. These are injury patterns we see with an unrestrained driver. So if I'm not wearing my seatbelt and I hit a car head on, I could see these two patterns. Up and over is going to go up and over the steering wheel. I'm going to see a spidering in the windshield where my head hit, which can cause some head, neck, and back injuries. Or down and under, I'm going to slide underneath the steering wheel, and I'm looking at lower leg injuries, more than likely. Here's a nice picture of airbags. This is definitely a front end collision because you can see that the airbags are deployed. Here's a spidering in the windshield. Usually that's caused by someone's head, and head could possibly hit that. Motor vehicle collisions, rear end collisions. There's also side impact, which is your T-bone, and your rollover. With your rear end collisions, we're looking at like neck injuries, the whiplash. Side impact could be a whole ton of injuries if they get hit. The force on that side of the door or a car could cause a lot of injury, and rollovers definitely can. Here we see a rear impact, pretty good one. Here's a side impact. Again, you could understand there could be quite a few injuries in this. And a rollover. Rotational impact collision. That's when the car is struck and then it starts spinning. And remember, it can often cause subsequential impact, which means it could be spinning and then it spin into a tree, causing another impact. Just remember, and I know the book says it, if you read your book, there's 3 impacts in a collision. There's when your vehicle hits the object that it hits. That's the first collision. The second collision is when your body strikes the car or collides with the car. For example, chest hitting the steering wheel. And the third collision is when the internal organs slam into your frame of your body, like your heart and lung would hit your chest wall. So there's three collision in every three impacts in every collision. Let's talk about falls. Significant falls are characterized by adults falling more than 20 feet and children under 15 years old more than 10 feet or 2 to 3 times the child's height. Picture of someone that looks like he fell. Important factors we need to know about falls. We need to know how high they fell from. What did they land on? What type of surface? Was it concrete? Was it the ground? Was it a pool of jello, right? So that's important. We need to know what part struck the ground. Did they land on their feet first? Did they land head first? Did they land on their side, their chest? We need to know this so we can start predicting maybe some possible injuries. And anything that interrupted the fall, like they fall off a ladder and they hit a tree branch on the way down. It's all important. So we can start thinking of injury patterns, right? And remember, when you fall and that sudden stop, that energy is transferred. So what I mean by that is if I fall 20 feet and land on my feet, I'm not only going to have like ankle injuries, foot injuries, that energy is going to go on up through my legs. So I could have knee injuries, femur fractures, hip involvement, even back involvement. And vice versa. If I fall and hit my head, I have neck, that's going to be transferred, head, it's going to be transferred to neck, that energy is going to go on down my back. Penetrating injuries. Injuries caused by an object that passes through the skin and other body tissues. We have different classifications for the velocity. It's either going to be a low, medium, or high velocity. Here's low velocity would be like a knife. Damage is limited to where the stab wound or the penetration. Maybe multiple wounds, however. Because, for example, you get stabbed in the abdomen and they could twist the blade, and that could cause multiple injuries. Now, with medium velocity, is using like a handgun bullet, or high velocity, which is a rifle bullet, like an AR or hunting rifle. They can have injuries anywhere throughout the body. Damage direct from the projectile, and there's damage coming from the cavitation or the pressure-related damage. And here I have a good example of the cavitation. You can see the bullet and the pathway of the bullet, and then behind it, you got that big expansion. That's that pressure or energy coming from the bullet ripping through the air, pretty much is how to explain it. So not only is the bullet going to do damage, the cavitation behind it's going to do quite a bit of damage. Blunt force traumas. This is where you get hit or a blow that strikes the body but does not penetrate the skin. Signs can often be overlooked. We may see like a little reddening on the skin or like the chest, but the energy is transferred, so we could have a lot of internal injuries. Maintain a high index of suspicion based on this mechanism of injury, right? I get hit with this object, yeah, it may not break the skin, but I can have a lot of internal injuries from that force. Nature of illness. This is a medical call. This is a lot of our calls, right? It's medical. The reason why they call 911. To identify the nature of the patient's illness during scene size up, you're going to scan the entire scene, right? Nice picture. This looks more like a trauma than an illness, but we can't get tunnel vision on the traumatic injury. Maybe he had an illness to start with that caused the injury. We can get information about the illness from the patient, maybe from the family or bystanders, or the scene itself, right? We can see like medications, maybe drugs and alcohol on scene. We can see different things, living conditions. Those can be signs. We need to find out how many patients we're going to have and if we're going to need more resources, right? So how many patients present? Do we have enough providers to take care of these patients? And not only that, Do we need specialty resources like a helicopter, hazmat team, fire department? And you're going to follow your local protocol. Going to chapter review now. Scene size up first part of the patient assessment process. It's important during scene size up to determine what, if any, threats may be to your own safety, the safety of others at the scene. And then we're going to take standard precaution. Next, it's important to determine the nature of call by identifying either the MOI, mechanism of injury, or the NOI, the nature of illness. Finally, you must take into account the number of patients and other factors at the scene to determine if you're going to need additional resources. Determine what, if any, threats may be to your own safety and the safety of others at the scene. So this starts from the drive up. As we're driving up, we're looking for these scenes, right? We're looking like car wrecks. We're looking for down power lines. We're looking for fuel. We're looking for fire. We're looking for hazardous materials, right? If it's a nature call, nature of illness, before we even go in the house, we're looking to make sure there's no dogs. There's no the stability of the structure. Does it look like it's going to cave in on me if I walk in on this porch? And other stuff like that. How many people are on scene? Any suspicious people on scene? So we have to keep all that into consideration. Identify the MOI or NOI. We're going to determine the number of patients and if we're going to need any additional resources. Not only do we have more than patients that we can handle, but maybe we need a helicopter. Maybe we need AOS. Maybe we need fire department, police department. These are all additional resources. And that'll do it. We will catch you on the next chapter, chapter 12.